Good morning. Today we're going to be talking about how to boost immunity. Specifically, how to use micronutrients for boosting our immunity, especially in this time of COVID-19. I have a few disclaimers. This is the disclaimers. You can read through them. I love teaching and I love to present the latest research. Today, we're going to be doing a few simple tasks. I want to very briefly review the immune system. I want to discuss specifically how micronutrients can influence our immunity. So very important. Very specifically in this time of COVID-19 and the pandemic that is sweeping the world, we need interventions that can be effective and accessible and affordable for our patients. And micronutrients fit the bill for this. I'm going to be reviewing the recent publications that I have found in the literature supporting micronutrient recommendations for our patients. So the essential questions: what can we recommend for our patients? And what interventions can help with this pandemic? Especially, what is cost effective? Very important questions when so many people have lost their jobs. So let's get started. COVID-19. This is a summary slide that I want to review very briefly of what we're dealing with this viral infection. And it's broken down into a couple of different avenues that can give morbidity. As you can see, this virus will come in, will infect the nasal and respiratory mucous membranes and can go on to cause pneumonia. In addition, then, once it sets up housekeeping in our bodies, it inhibits and affects other systems in our body. It goes after our immune system. And when it takes hold, it can increase those angiotensin converting enzyme expression and can affect heart, kidney, renal failure, and systemic organ failure. In addition, it affects our immune system. And this will all lead to a dysregulated body and a dysregulated immune response. Not good. So we need some good interventions that can try to nip this in the bud before it gains hold. So a very brief review of our immune system. It's basically 3 tiers. There's the mucosal immune system, nose, lung, GI tract, urogenital. There's the ongoing process of this immune mucosal system. It's where secretory IgA is produced, and there's T cell expansion. Then there is the nonspecific innate immune system, responds very rapidly in the first 6 to 12 hours. And then there is the ongoing adaptive immune system. It's specific to need, responds more slowly, and it's ongoing. Starts at day 1, heightens at day 3 to 5, and then goes on day 7 and on into the future. So all 3 of these can be influenced. The mucosal immune system, the innate immune system and the adaptive immune system. Let's take a look at this. And again, they overlap. Mucosal is first. Innate gets cranked up and overlaps with that mucosal. The innate becomes paramount, but the adaptive begins, and then the adaptive continues on. Let's see how this is represented in our bodies. With secretory IgA being produced, it's in our nose, our lungs, our GI tract, our urogenital tract. And what you can see is that the T cells become activated as the virus enters through the mucous membranes, the ciliary mucous membranes of our lungs, for example. In this diagram, it demonstrates the two ways of the primary immune system that then takes over once the mucosal has been bombarded. Here's your innate immune system. It's getting activated within that first 12 hours. So the microbes, the viruses are coming in through the epithelium of our nose, of our respiratory tract, of our GI tract perhaps, and it's beginning to stimulate these macrophages, the neutrophils, some natural killer cell activation. The dendritic cells are becoming activated. The dendritic cells try to work with the viral particles. And overlapping is then the adaptive immune system. And this is where those antibodies are beginning to be really produced at high numbers. The T helper cells, some cytotoxic lymphocytes being produced. Eventually, further down the road, perhaps some cytokine stimulation. So here's a wonderful little diagram that demonstrates this more clearly. This innate immune system, the blue line on the graph at the bottom of this diagram, you can see that this innate system spikes in this first 12 hours. But the adaptive immune system also begins, and it responds more slowly the first time, but you can see our white blood cell system is being activated, and we're beginning to crank out a lot of our different white blood cells. Our T cells, our B cells are getting activated. They're starting to respond with the antibody production. Another diagram of how the COVID-19 virus affects the virus coming in, stimulating that innate immune system, and turns on the adaptive immune system. And the regulation of inflammation tries to take over. Their memory cells are being produced. And here on the right side of this diagram, again, you can see the point of infection skyrocketing with the mucosal immune system beginning, triggering off the innate immune system. It skyrockets within that first 10 to 12 hours, and then the adaptive immune system is triggered and begins to take over, stimulating more of the T cell and B cell memory cells antibody production. Let me back up just 1 second. I just want to mention this. In the references that you are given, all of these citations are listed, and you can click on the URLs and go straight to these documents as well for your benefit. Here, we're just doing a very quick overview, but presenting the references that then you can look at more fully as your time and opportunity allows. You will get these URLs so that you can see these different diagrams with a fuller explanation available in the different references. So let's talk about the nutritional interventions that we know from the recent literature that is being published of what we know can help with the COVID-19 and this pandemic virus. This first study here, I want to review with you. It is a study where they went back and looked at clinical trials, observational studies that highlight the different micronutrients that can stimulate our immune response. And specifically, what you see here, and I've highlighted some of the important points, they are highlighting vitamin A, vitamin C, vitamin D, omega-3 fatty acids, and zinc. A note about vitamin A: be sure that the vitamin A that we're talking about with patients is the retinol vitamin A. Just as a pearl, many patients, if they're depending upon beta carotene from foods such as carrots and spinach, those are helpful, but those have to be converted to the retinol vitamin A for the liver to use the vitamin A to make metallothionein protein in the detoxification pathways. So as you're encouraging supplements for patients, be mindful of this. Yes, good nutrition is great, but if you know someone may have a genetic polymorphism in that pathway, it would be good to supplement with a good multivitamin with some retinol vitamin A. In this particular study, they highlight, as you can see here, these different micronutrients and what do they do specifically with our immune function. And what you can see is they break it down. What does vitamin A do for the innate immune system, for example, versus the adaptive? And you can see there are many functions of each of these micronutrients. And again, you have the link to this particular study that then you can examine and look at as your time allows. But for example, this vitamin A, we know that it helps with skin, hair, nails, and eyes. That will help that inflammatory innate immune response, but it also helps with differentiation of B cells. So what they're finding are that these particular supplements help with both pathways. And so if we can get these supplements on board with patients before they get infected, it's a win-win situation for both the innate and the adaptive immune system. I want to point out here that when you look at this vitamin D, production of antimicrobial peptides, and in the adaptive protection against cytokines, and again stimulating protective cytokines. So you'll see both these nutrients are valuable for the innate as well as the adaptive immune response. Let's go on to the next study here. This is a study where they looked back at interventions from research done to boost the antiviral status of patients based on previous coronaviruses. COVID-19 is a coronavirus and an RNA virus. Early in this infection, clinicians were going back and looking at past research, and this article comes out of that past nutrition-based therapies that are effective against coronaviruses and viruses of the past. So, and just recently published in September 2020, all of these articles that I'm highlighting have just been published in the last several months. In this particular article, they make another summary chart of the nutrients, the micronutrients that are helpful against COVID-19. And as you can see, zinc is at the very top of this list as an antioxidant, helping to inhibit and halt the replication of COVID-19. It helps also to target the ACE2 receptors. Further down, you will see again our selenium as a mineral that helps to inhibit the ACE receptors. Very valuable antioxidant. And again, your vitamin A, your B vitamins, we'll be talking more about B vitamins in just a few moments. The long-term friend of ours, vitamin C, high-dose vitamin C is a premier antioxidant. The vitamin D as an immune modulator, and vitamin E for the help with the production of our natural killer cells. So, and again, these are some simple charts for your review, but then also you can print out and give to your patients so that they can understand the justification of these different nutrition micronutrients. So our next article is hot off the press. In fact, it's pre-printed. As you can see here, I've highlighted it. It is to be published in January 2021. But again, this is a review of the literature of what do we know that can help against COVID-19, the immune boosting micronutrients, again, highlighting a different set of authors coming up with the same conclusions: vitamin D, vitamin C, E, zinc, selenium, and omega-3s. And they raise the important question, can these help decrease morbidity and mortality of our patients? You will hear me say this later. The most, I think, cost-effective treatment that we have is prevention. And if we can have our patients take these micronutrients, it can help them survive this virus and very potentially survive the long-term, long haulers morbidity that we have begun to see with some of the unfortunate sequelae of COVID-19, the long-standing COVID-19 difficulties. So directly from this article, a small diagram again demonstrating these 6 nutrients and where they can help with this virus. Very specifically, I want to point out this vitamin C and selenium, we think, helps to dampen down cytokine storming. Vitamin E, helping our natural killer cells in their defense against this virus. Zinc, the all-important zinc, putting a lid on the virus, the viral uncoding, viral replication, and we can encourage our patients, and you know, a picture is worth 1,000 words. If we can get them to take some good micronutrients, good omega-3 fatty acids at sufficient levels within their diet or as a supplement, we are hopeful that we can get on the other side of this virus successfully. So let's do a little bit deeper dive. And I've put this particular diagram in as a review of the vitamin D physiology. We're going to be talking some more about vitamin D in just a few minutes. But let me go through this because it has such an impact on our immune system. You know, vitamin D is considered the sunshine vitamin. In the northern latitudes of the United States, we don't have vitamin D except for June, July, and August. And so we have to be very mindful of this with appropriate supplementation during those winter months. Vitamin D can come into the body through fortified foods in our diet or through supplementation. Cholecalciferol can come into the liver. And I want to make a special note here. This 25-hydroxy vitamin D coming out of the liver into the kidney. We're going to be seeing this word in just a few minutes with another study. The particular type of vitamin D coming out of the liver into the kidney is called in another study calcifediol, and we're going to be seeing a randomized study in just a few minutes that demonstrate how helpful this vitamin D is for our COVID patients. The correlation. So the vitamin D comes through the liver, through the kidneys, becomes 125 hydroxy vitamin D, and then that 125 hydroxy vitamin D goes on to have the cellular effects of D3 at the gap junctions, at the mucosal membrane of the lungs, for example, of the immune system, the macrophage modulation, and of particular importance here. You can see they've summarized what are the clinical effects of vitamin D3. There are 4. Vitamin D3 has been shown to help decrease inflammation, decrease acute respiratory distress syndrome, decrease the sequelae of the acute respiratory distress syndrome that can lead to pneumonia, and decrease other infections. So vitamin D3 is a powerhouse that can help, cost effective, and it can go a long way for helping decrease morbidity and mortality. Increasing Treg cells here that you can see. Decreasing mucosal secretions. Again, from the previous slide, increasing the length of the ciliary fibers in the lungs, for example. And again, another summary slide of specifics of what vitamin D can do. It helps with the antimicrobial response. Chemotaxis, that movement of our immune cells. Phagocytosis, where the viral particles are then engulfed by our our macrophages can help put a lid on reactive oxygen species. Remember, for our enzymes to manage reactive oxygen species, we need the SOD enzymes functioning, which requires zinc, copper, and manganese, important minerals for managing these reactive oxygen species. And through the rest of this motif, you can see stimulating the Treg cells and macrophage differentiation. So some specific articles that you can see here of a discussion of vitamin D, and is there a correlation? And this particular article is a review article in which there were, the authors went back and looked at what do we know in the past out of studies specific to vitamin D. Some of those previous slides were review articles conglomerate of multivitamins and micronutrients, but this article is specific as to what do we know can improve immunity and protect specifically against respiratory illness. And what they are seeing is there is a very strong link between vitamin D levels and our susceptibility to COVID-19. And this is the theory as to why young people seem to be immune or asymptomatic to the sequelae of an infection, is that younger individuals have higher levels in general of vitamin D, and they're able to help mount the immune response and be protected against COVID-19. Let me review these next couple of slides with you. These are graphs in a chart review. This particular chart review was done, let me review my notes here, of 212 patients in which they looked at the levels of vitamin D in contrast to the severity of the disease. And their cutoff for vitamin D level as being normal or not was 30. That's a very modest low level of vitamin D. But what you can see is there, the blue line is normal vitamin D levels of 30 or over, and the intensity of an infection with COVID-19. And what you can see is that there is an inverse proportion with strong vitamin D levels. The infection with COVID-19 is markedly lower. However, when your levels are low of vitamin D, then you begin to see high levels of severity and critical levels of COVID-19. So again, arguing that there appears to be a good, a cost-effective intervention that we can stress with our patients to prevent the severity of a COVID-19 infection. Here is the second chart review. The previous chart review was done, a Swiss review. This is a chart review done in India. And again, what you can see is that if you have sufficient vitamin D levels, the severity of the disease is markedly decreased. Whereas if you have insufficient, the severity of the disease is markedly increased. And in this particular study, what was recommended was, in what they reviewed is those individuals that took 4,000 international units of vitamin D3 per day demonstrated normal levels if they had been taking that amount on an ongoing basis. This is the most recent article that has just been released. Actually, this last week, it was just published October 2020. And remember earlier in the physiology slide of vitamin D, I mentioned the type of vitamin D, calcifediol. That's the vitamin D that was given in these ICU patients. This is a study out of Spain where they studied 76 individuals, and they did a randomized, this is a pilot randomized clinical study where they randomized 2/3 of the patients received calcifediol, 1/3 of the patients did not. Again, so it was a 2-to-1 randomization, and they gave a bolus dose of calcifediol, 532 micrograms or 0.532 milligrams on admission. So they gave a big bolus dose of calcifediol at time of admission, and then half of that on day 3 and 7. And the results demonstrated that there was significant reduced need ICU treatment and for patients requiring inpatients requiring hospitalization for COVID-19. I would send you back to this particular article because this is one of the first pilot current randomized clinical studies for vitamin D, giving vitamin D and then assessing the morbidity and the mortality of patients needing ICU. Those patients that were given the calcifediol, all of them got discharged. Of those that did not receive it, there were 13 patients admitted to the ICU. 2 of those died, regretfully. The other 11 were discharged. So some good, meaty research is beginning to be published of some of these randomized studies documenting how the supplementation can be helpful. So let's go on and look at zinc, one of our chief minerals for COVID-19. In this particular study, it was a prospective study where they looked at COVID-19 patients and their zinc levels. And they looked at those with those that were sick and what were their zinc levels, and the conclusions is that zinc significantly enabled patients to have fewer complications with acute respiratory distress, less need of corticosteroid therapy, and less mortality, less prolonged stay in hospital stays. So again, this particular article has just come out this month, November 2020, in the International Journal of Infectious Diseases. So you can see some of these current studies are now being published that we can use to increase the awareness of our patients. Take some zinc, take some vitamin D3. It could save their life. This is a summary study that was published in April, looking back at what is known about zinc for managing viral infections. And you can see the highlighted sentence here: improved antiviral immunity with zinc, and the proposed mechanism of action is the upregulation of interferon. It has anti-inflammatory activity, inhibiting the TNF kappa B signaling, and modulating, helping to control that regulatory T cell function that could help prevent and limit the cytokine storm. It's a modulatory effect. Zinc appears to have a modulatory effect to keep our immune system from overshooting the target, so to say. And that particular study, that citation gives this motif of how zinc can help with respiratory infections. So let me go through this. We think that zinc specifically helps prevent the replication of the virus. It can help with stimulating the length of the ciliary cells in the lungs that can help with mucociliary clearing. It helps with decreasing the inflammatory response. It's helping with boosting our viral antiviral T regulatory cells producing antibodies. And with the summary of these 4 ways that it's helpful, it puts a lid on, it cuts off, or it decreases some of the co-infections that can occur simultaneously, the pneumonias, bacterial infections, and helps to prevent, decreases the need for ventilatory support in patients, because it decreases that acute respiratory distress syndrome, helping to cut down on some of the pneumonias, some of the thickening of the pulmonary mucous membranes, the globular coagulation of mucus in the lungs, etc., and helping to decrease some of these risk factors for some of our patients that suffer from obesity, diabetes, atherosclerosis, etc. So another very important study has published online in July, came out in the print in November, again summarizing the impact of zinc, of what we are now seeing with zinc, with the pathophysiology of COVID and its antiviral activity with inhibiting the viral RNA polymerase. And by inhibiting the viral mRNA polymerase, it is helping as an anti-inflammatory and modulating, that's an important word, modulating the T cell response and helping to limit the cytokine storm that occurs. And based specifically on that article citation, this particular diaphragm you'll find within that article, I want to go through this very briefly because it just summarizes very nicely some of what we are beginning to learn about the effect of zinc. And as you can see here in the upper left-hand corner, the risk groups that we're seeing, and that's the blue circle, and those that have some severe risk factors with infection is the red group. What we believe is that the zinc, from our studies, the zinc helps, number 2 there on the left, it helps to inhibit viral replication. And then under number 3, it helps to support the ciliary mucus, the ciliary function in the lungs, and preventing the viral particles from attaching. It helps to increase the fibers, the ciliary length of those fibers that create the lung barrier. And then on the right-hand side of this particular diagram, numbers 5 through 10, it helps to normalize that cytokine release, the cytokine storming. And what we think is that it helps to prevent the overwhelming overshooting of the immune reaction to help temper down the cytokine storms. So let's go on. The next article I just want to put before you is what we are beginning to also think about with the vitamin B family. Vitamin B's, thiamine, riboflavin, niacin, folate, vitamin B6, pantothenic acid are all helpful for helping our immune system to function. If we don't have those B vitamins, we're going to have a predisposition to increased inflammation. And this particular article denotes and points out hyperhomocystinemia as a huge target, as an inflammatory marker. We know that B vitamins can help with both the innate and the adaptive immune system, reducing cytokine levels, increasing our respiratory function, endothelial function, and helping us just, fight off this virus. So let's go a little bit more to take a deeper dive into looking at these B vitamins. Here you can see a cartoon, a diagram from this particular article, Be Well, the Potential Role for these B vitamins with COVID-19. And so I just want to review this very, very quickly with you. Vitamin B1 is thiamine, and we believe that it helps with our adaptive immune response. And it's helping to ward off the viral binding and adhesion to our ciliary membranes. Over on the left-hand side, you will see that B2, riboflavin, and B3, niacin, we believe, help to block down against viral replication. At the bottom of the cartoon, pantothenic acid, helps to control cytokine storming. And then at the very bottom, you will see B6, P5P, which is the active form of B6, can help guard against hypercoagulability because it's one of the factors that's needed to help control homocysteine. Now, just a word about vitamin B6. 25% of people, vitamin B6 is pyridoxine hydrochloride. That's B6. 25% of people find it difficult because of genetics to convert it to P5P, pyridoxal 5-phosphate. So if you want to hedge your bets in favor of wellness, which we all do, choose a B6 that's P5P, pyridoxal 5-phosphate. You have to have P5P in B6 in its active form of P5P to bring homocysteine down into the transsulfuration pathway. It's required. You've got to have P5P as the active B6 for that CBS enzyme to bring homocysteine down into that transsulfuration pathway, controlling homocysteine levels. That's why on this particular diagram, you see B6 along with B12 helping to control the hypercoagulability that we think comes along with high elevated levels of homocysteine. So choosing a good B complex along with a multivitamin can be extraordinarily helpful for our patients. And this is just a very brief summary again of how different B vitamins help our innate and adaptive immune system. I put this in as a little tiny cheat sheet, just again earmarking how we've got to have B vitamins to help our B cells, to help our natural killer cell function, and to adequate B12 in order to help with preventing elevation in homocysteine, for example. So again, just a summary sheet that you can go back and study more as your time allows of why these nutrients are so critically important. And these have to be inside the cell. Let me just plug away at that also. You've got to have these nutrients inside the cell. That's where methylation occurs. That's where that homocysteine is being formed and has to be regulated inside the cell. So let me go on these next two slides. I would be remiss if I did not mention the research that is coming out on the efficacy of the therapy for N-acetylcysteine, NAC. These particular articles they've just appeared in the literature in the last couple of months. This one, August 2020, the rationale and use of NAC, N-acetylcysteine, for the prevention and therapy of COVID-19. Now, just remember, N-acetylcysteine, we think in functional medicine, is the rate-limiting step for making glutathione. You have to have some glutamine, glycine also to make glutathione, but we think NAC is the rate-limiting step for making glutathione, and glutathione is the chief antioxidant of the body, and we know that this virus causes massive oxidative stress. That is why NAC could be so helpful. And in addition, it's a mucolytic agent. It helps to break down the mucus, thin out the mucus in those mucus plugs in the lung so that oxygenation can continue to occur. So NAC, a very potent, broad-ranged antioxidant and anti-inflammatory. This is the second article. This particular article just published in June, and I just had to summarize some of their important points. I didn't have room on the slide to put down their entire the abstract, but let me just go through these. These authors hypothesize and summarize the information that we have about N-acetylcysteine. It helps to decrease the COVID infectivity of the virus. It helps to block excessive production of angiotensin II, helps to block ACE, angiotensin converting enzyme, attenuates reactive oxygen species, helps to restore glutathione reserves, inhibits NF-kappa B, and helps to restore those sulfur thiol pools for reactive oxygen species scattering. So NAC, a very potent preventative. I'm having my patients take it twice a day. But if you get COVID, or in my patients, I'm recommending if they get COVID, I want them to give me a call, but I'm recommending 4 times a day taking NAC. And so, which comes to my very last slide here of my recommendations of some of these different micronutrients. These are my recommendations. They've not been approved by the FDA. They're not meant to diagnose, et cetera, according to the FDA. And I just present these recommendations to you that you may consider for your patients, both the preventive doses that could be useful, as well as if somebody unfortunately becomes infected with COVID-19, how to ramp up some of these doses for during the time of active infection. And I want to mention here, look at this vitamin D3. If somebody is infected and they have not been taking vitamin D3 as a preventative, so their levels are really low, I recommend, a mega dose of 50,000 international units twice a day for 3 days, only for 3 days. I want to really jack up that immune response rapidly. And then during the course of the infection, after that, starting at day 4, we decrease the dose back down to 5 to 10,000. For zinc, again, preventative, 30 milligrams. But if people get infected, I want high levels of zinc on board for that, 6 to 10 days of severe active infection, increasing the dose. And you can go on down and see some of my other recommendations. I do want to make, I want to point out what I've put here for vitamin C. Preventative, remember vitamin C only stays in the body for 3 to 4 hours. Compliance goes down if you tell patients to take things more than twice a day. I understand that. I want patients to take some vitamin C twice a day. But if a patient becomes infected with COVID-19, we may have to sledgehammer, and I mean sledgehammer, with big doses of antioxidants. And so when you see this vitamin C, 1 to 2 grams per hour, the rate limiting step for vitamin C is when vitamin C gives you diarrhea. Then you pull back on it. But I have had patients infected with COVID, and they have taken 3 to 4 grams per hour for 10 to 12 hours a day, drinking it. That's one of the easiest ways to take that much. No diarrhea whatsoever. So massive amounts of oxidative treatment there, but they never got diarrhea. So just be mindful of this, that this is an intervention. Vitamin C is pretty inexpensive and can go a long way for helping manage the oxidative stress along with the vitamin D, the zinc, the B vitamins. So with this, we come to an end. I want to say thank you to SpectraCell, and I look forward to the discussions.
Thank you so much. That was some great of information. Thank you again.
Quite welcome. Thank you.